Hawaii's rural healthcare crisis: how transportation barriers are affecting lives. The healthcare landscape in rural Hawaii faces a significant crisis, and the evidence is undeniably clear. A recent study published by the University of Hawaii Rural Health Research and Policy Center, UHRHRPC, reveals a complex web of issues stemming from transportation challenges that severely hinder access to medical services in these areas. As highlighted in their detailed report titled The Impacts of Transportation and Travel Access on Rural Health in Hawaii, residents of rural and neighbor island communities face staggering obstacles when attempting to obtain timely and affordable health care. This comprehensive analysis, released on July 17, 2025, sheds light on the long ambulance response times, the high costs associated with unreliable non-emergency transport options, and the limitations of insurance policies covering travel-related medical expenses. With nearly 30% of Hawaii's population residing in rural areas spread across 6 inhabited islands, the geographical disparity becomes evident. Most specialty health services are concentrated on Oahu, leaving residents of Molokai and Lanai to grapple with flight cancellations and delays that often cause them to miss critical medical appointments, sometimes forcing them to wait months for rescheduling. Consider how frustrating and dangerous this can be for someone needing immediate care. Moreover, the report draws attention to significant gaps in insurance coverage, particularly for those who do not qualify for Medicaid, leading to prohibitive out-of-pocket expenses for travel, accommodation, and meals associated with medical visits. Matters become particularly dire for maternal fetal health services. For instance, some expectant mothers must relocate from their home islands to Oahu for essential prenatal and delivery care, or they risk being forced into emergency medical evacuations. John Desfer, a policy and data analyst at UHRHRPC, emphasizes, enhancing access involves a collaborative approach that spans the healthcare, transportation, and policy sectors. He expresses hope that this research will inspire actionable steps toward improving transportation access for healthcare services in Hawaii's rural communities. In response to these pressing issues, the report suggests several policy recommendations, such as expanding emergency air and ground ambulance services to improve response times, supporting community paramedicine programs to provide broader healthcare support, mandating coverage for non-emergency medical transportation under Medicare and private/employer-based health insurance in Hawaii, creating grant opportunities for community-based organizations to assist with housing for maternal fetal patients who must travel for care, establishing regional health hubs and mobile maternal health clinics to bring services closer to those in rural areas, exploring options to expand inter-island flight programs and investigate sustainable transportation methods for health services, addressing airline reliability issues through increased competition, leveraging programs like the U.S. Department of Transportation's Essential Air Service, enabling hospitals and clinics to receive reimbursement for transportation costs. This initiative was made possible through funding from the Hawaii State Department of Health Office of Primary Care and Rural Health, and the report includes a comprehensive 4-part analysis featuring a literature review, interviews with 40 stakeholders, policy recommendations, and a specialized subreport on maternal-fetal telehealth. Amy Grace, the principal investigator and director of UH Strategic Health Initiatives, remarked, "****, we are grateful for the extensive community participation throughout this project. ****, she emphasized that many stakeholders contributed valuable insights and stories, which adds depth and context to the suggested policies. This collective effort embodies the spirit of collaboration needed to tackle these significant issues effectively." For those interested in further exploring this critical subject, the Hawaii Public Health Institute is set to host a webinar on this topic on August 18, 2025, from noon to 1 p.m. Registration details can be found here. https://webinars/register/wn_02castqvs4SSDYC6WP-3A #sign/registration. But this poses an important question. Why do some people in policymaking roles overlook the fundamental need for reliable transportation as a key aspect of healthcare? We invite you to share your thoughts and experiences in the comments below, particularly if you have been impacted by these issues or have perspectives on potential solutions.